Time. Hello, everyone. Welcome to my broadcast. This is Winning Wednesday. And for tonight, we are back in Quick Facts for NCLEX. And we are actually going to be studying celiac disease. Now, my goal for you in studying celiac is to help you see what remediation actually looks like. Some of us, we feel like we're studying, we want to be studying, but we're actually not studying at all. There's actually no studying taking place because we forget. And who does this happen to? You forget once you close the book. How many people this happens to? When you close the book, you forget. So if you have this book right here, get this book out. We are going to open it up and I'm going to actually have you to do the work, not me. You're going to do the work, okay? And what that work looks like is just being able to answer basic questions. Come on in. It's Winning Wednesday. What I want you to do right now is put your flag where your country is representing. Where is your flag? What is your flag? I want to see it. Winning Wednesday is about you doing the work that is very difficult to do during the week, but you make time on Wednesday to do it. You say, I'm not going to be entertained. I'm not going to be distracted. I am going to focus. I see America. Okay. I see Jamaica. I see people in Canada. All right. I love that. Angelina, she's back. She says, I'm a Remar nurse, but I'm coming to get more knowledge. And so what we're talking about, Jamaica, I see you. Jamaica's on TikTok, heavy. American, Tanzania. All right. El Salvador. What do I have? Puerto Rico. Of course. Ireland in the house. Everybody put your flags, okay? Put your flags up. So we're going to be doing very quickly is diving into celiac disease. How many people feel like they already know celiac? And you can answer any NCLEX question, case study, multiple matrix, fill in the blank. How many of you feel like I got celiac disease? I know it. Well, if you got celiac and you know it, my remediation class tonight, okay, is going to put that to the test. The test. So the first question I'm asking about celiac, just put it in the comments. What kind of condition is celiac disease? What type of issue? And again, when you have this quick facts book, this is a brand new quick facts book. It looks like this. See how clean it is? See how pretty it is? Well, not this page. All right. This is how it will come to you. Somebody says it's gastrointestinal. Yes, kind of. All right. But something else. You guys' quick facts should look like this. It should be bad. It should be all written in. That's how this book works. Okay. There you go. I was looking for autoimmune. It's an autoimmune condition. So if you didn't know that, strike one. Because we're here for content and critical thinking. I'm on page number 22. Okay. 3 strikes, you're out. 3 strikes means you need remediation. That's my first question. What type of condition is this? This is an autoimmune condition. Second question. All right. What food product can they not have? What is the major offender in celiac disease that we're talking about? Okay, this is coming up for strike 2. So, I see it. Gluten-free food. Because remember, when we talk about celiac, the problem is they are not able to absorb gluten. And gluten comes from most of our diets. Most of you in here are gluten eaters. Okay. And this is why for NCLEX is so important for you to understand this concept. Because when people are diagnosed with this, are they infants all the time? Okay. Some people can grow up eating gluten and then develop a sensitivity to it. So we're not talking about babies. We are talking about people who have established what they like to eat. And so, anyways, let me tell you this. So, if they continue to eat gluten, what is going to become of them? What will become of people with celiac disease who continue to eat gluten? All right. And this is how we do critical thinking on top of content. I don't want you to just know gluten-free. I want you to understand why it's important to know gluten-free. Okay. And you're doing beautiful just by being here. So many people are going to swipe away from this because they don't want to do the hard work of studying. Everybody wants the easy way to study. But I will absolutely tell you, when it comes to success, there is no elevator. You have to take the stairs. Everybody who does this the right way, they take the stairs to the top. No elevator. Okay? So absolutely, they will suffer from malnutrition. That's the big thing. They're going to suffer from malnutrition. And so if you are not nourished, you begin to waste away. That's what happens. Okay. So anyways, that is what we're talking about with celiac disease. Now, let's go back to our first point. When I asked what kind of condition this is, you told me that it was an autoimmune condition. So, what are the implications of autoimmune condition? Well, we know that when something is autoimmune like celiac disease, the body does not recognize its own self. The body doesn't recognize its own self. So that means the body treats itself like an enemy. And that means that anytime the patient has gluten, their body will have a inflammatory response. Very good, Nicole. Very good. Huge point to know. Because there's many inflammatory conditions. There's many autoimmune conditions, right? So autoimmune conditions can be systemic or they can be local. Does everybody know what that means? Those two words. Autoimmune conditions can be systemic or they can be local. Now, when we talk about celiacs, is it local? Is it systemic? What do you say? Is this a systemic autoimmune system disorder or is it local? That's very good. I don't know if there is a right answer because it can be both, but surely it starts off as local. Okay. Surely this starts off as local because it is going to affect the bowels. Okay. The patient will be able to eat gluten. It won't affect the mouth. It won't affect going down the esophagus. It won't affect the stomach. But when it gets to the small intestines, they will have issues there. It is going to damage the small intestines, all right, at first. And that's what is going to be the local response. And because it is affecting the intestines, it's going to spread systemically. Okay. So that's something that I want you to think about. Now, whenever we study a disease process, it's good for us to study pharmacology with the disease process. We never want to study pharmacology by itself. So when you talk about autoimmune conditions, this is for strike number 3. When we talk about autoimmune conditions, inflammatory responses, what is the major medication that we give to stop the inflammation response? What is it? What are we going to give this patient? I see it already. Good job. Come on, give it to me. Good job, TikTok. You got it. Pow, I see it. Absolutely. Ooh, Facebook too, and YouTube. Yes, everybody. Now look what you just did. You just did critical thinking. This is what you need to do to pass NCLEX. But also, this is what your studying should look like. What we're doing right now is called remediation. Most of you need this in your life. You're not getting enough of this. Just like you're not drinking enough water, you're not doing enough remediation. Okay? Because you just made a huge leap from pathophysiology to intervention. Great job. Now that we are all at the intervention, the next level is anticipating complications. So, with that medication that you just typed in, what is the biggest complication of putting a patient on that medication that NCLEX wants you to be so aware of in terms of safety? In terms of safety, I'm not even going to say the medication because you got it right. When I look at the comments, you got it right. What is the issue that NCLEX is going to spotlight? Okay. Celiac disease. We're in quick facts for NCLEX. There you go. The issue is exactly immunosuppression. How did we get here? We were just talking about celiac disease. How did we now get to immunosuppression? The reason why we got here is because you are critically thinking nurses. Okay? So if you got that one right, you're still in the game. If you didn't get that one right, that's another strike. Okay? All right. So, anyways, we have to avoid certain foods. Quick Fact says those foods are brow, stands for barley, rye, oats, and wheat. That's something you should also know. If a patient ingests barley, rye, oats, and wheat, they will start to flame up. Their body's going to get out of whack. Okay. I also make this note that the client's abdomen will be distended. You know, distended means way out here, not flat, way out here. Why is the patient's stomach way out here in celiac disease? It is going to be from the fact that, simple fact is that they are not absorbing this food. And when food stays in the stomach, what does it begin to do? That's really gross. Not in the stomach. Actually, let me use my correct terms. When food stays in the intestines and it doesn't get absorbed, because this is a malabsorption, what becomes of that food? What does it begin to do? Yes, of course. They get backed up. They do get backed up. But why is the belly sticking out? Because that food begins to ferment. Yes, that was what I'm looking for. That food begins to ferment and it begins to create gases. Okay? Gases. And so that's why the abdomen is so distended. All right. And so it is important for you to know for NCLEX what stool looks like. Okay? Stool is so important. It's just like urine. There's a reason why we spend almost a whole week studying what urine looks like, the different colors of urine, the different colors of stool. So let's play a game. You will know if you're a nurse if you know the answers to these questions. Okay? One word in the comments. We're going to play a game. What does this mean? If the stool is this color, what does it mean is happening on the inside? Now, in quick facts, I tell you what the stool is like for celiac disease. Smelly, pale, bulky, okay, and it will float. If a patient has stool and that stool is black and tarry, put it in the comments. What does that mean? This is remediation. We're going over things, okay? The villi of the small intestine are sensitive to gluten. And the small intestine is responsible for absorbing your nutrients. So that's why it gets damaged. You know you're a nurse if you put bleeding. Okay? You know you're a nurse. Okay. If the stool of the patient is orange, if they have orange stool, what do you know about that patient if it's orange? What do you know about that patient? Okay, we need more anatomy. Okay, I got you. If it's orange, what does that mean? They are taking a medication. Yes, rifampin. Okay. We're talking about the stool. We're talking about the stool. What if the stool is bright red? Like it's bright red. What's the one thing that will cause bright red blood? Because we know if there's GI bleeding, it is dark black tarry. But if it's bright red, what does that mean? And it's not even something, it's not even something that's like, oh, beets. I didn't think about beets. Beets do cause that. But hemorrhoids, yes, if a patient has hemorrhoids, that causes that bright red blood. Yes. What if the stool is white? What if it's all white? Do you know what that means? Thank you, Evelyn. Evelyn says, I'm still here, even though I'm a nurse. Pop, Remar nurse. If the stool is all white, like it's like bright white, what have they done? Or what have they just gotten done? Do you know? Do you know? Okay. And this is what we do every Wednesday. It is because they had barium. It's because they just had a procedure. You got to know this stuff, nurses. You got to know this stuff. Okay, I'm moving on because I'm not here for a long time. I'm just here for a good time. Okay. So keep up on that type of stuff. That's the type of stuff that is in quick facts. That's the type of stuff that gets you to think. When you're reading this book, you are supposed to be critically thinking. That's asking yourself questions. Okay. All right, I'm moving on. Let's go to the next let's go to the next page. When you talk about celiac disease, patients cannot have gluten. What can they have? What are two foods? Just give me one. What is one food that they can have? Even though they might want gluten, don't feel like that. Oli says, I'm feeling dumb. No. Oh, I like that. Yes, they can't. No, they cannot have wheat. They cannot have wheat. They can have rice. They can have corn. They can have quinoa. Somebody put that in there. Some of you guys love quinoa. I don't love it, but they can have it. Quinoa, rice, corn. Why are these the best things to eat? Because they're gluten-free. Gluten-free, and they're very easy to find. Very easy to find. Okay. Yes or no? Yes or no to these foods? Just give me a yes or no. If my patient has celiacs, can they have spaghetti? Yes or no? Can my patient have spaghetti? Spaghetti is a favorite. If you're American, if you grew up like I grew up, spaghetti is magic. You literally, if your mom makes a pot of spaghetti, you can eat that pot of spaghetti for like 5 days. It's like it never runs out. It just like keeps overflowing. Spaghetti for NCLEX, no. Okay. What about cookies? What about cookies? Yes or no? Cookies? Uh-huh. But I'm just saying, no, if just say no. Don't get too deep into it, okay? Because NCLEX is not going to say gluten-free or with gluten. They're just going to say, can the patient have cookies? Okay, and you got to know that. What about let's go down a bit and let me push you critical thinking because you guys said no pie, no cookies, no waffles, no pancakes. If a patient lives in the house with other people, but they are the only one with celiac disease, do they have to use separate cooking appliances? Do they have to use a separate toaster? I'm critically thinking you now. I'm cooking, I'm warming you up. If a patient's living in a house and they like, okay, I know I cannot have the same waffles as you guys. I'm going to have my gluten-free waffles. Can they use the same toaster? How extreme is this? That's what I want you to tell me. Okay. Can they put their gluten-free waffles in the family toaster? Yes or no? Oh, has anybody ever asked you that before? Has anybody asked you that? Some of you guys are saying no. Some people are saying, yeah, it's okay. It's okay. I don't know. Yes, no. See, and this is where NCLEX separates the regular nurses from the Remar nurses, because we go over stuff like this. This is why you come to class, okay? Correct answer: no, they cannot use the same toaster, okay? You're not going to use the same toaster. All right, if you learned something today, say, I learned it, okay? That was the bell to help you remember this forever, because with celiac disease, if even the crumbs of that gluten waffle gets into their system, guess what's going to happen? Boom, immune response. So it is so important that they have, and this is why, yes, toasters are not normally washed after. Toasters are not normally cleansed. Is something that people just use. If you don't have this, this is an American culture thing. This is how NCLEX is a cultural test. Because in America, we have toasters and we never clean them. So you have to anticipate that for your celiac patient. Okay. Anyways, I'm not staying here long again, because the whole thing with celiac disease is that this is, okay, this is something that affects the small bowel. All right. And so if they get a crumb on their food and they ingest it, they get multiple crumbs. They do this every day. Most people, when they eat waffles or they eat breakfast stuff, you eat it every day. I learned this, but I have seen it in my workplace. They use the same toaster. Yes. Aggie's probably the international nurse, because you're like, you've seen it. You've seen this done in your workplace. So you keep doing that day after day after day, you're going to have some inflammation. Now, let me ask you this question. This is my last question I'm going to ask you is, when we talk about the damage done to the small intestine, is the small intestine something that can repair itself, or once it's damaged, is it permanently damaged? Hi, Miss Regina. I would like to say thank you. I passed my NCLEX on the first try. Congratulations. Congratulations. Angelina says, I always learn something every time I listen to you. That's the goal. Okay. That's the goal. Can the small intestine tissue repair itself, or is it something that when it's damaged is permanently damaged? You guys know we talked about organs that can repair themselves, and we talked about organs that cannot repair themselves. We talked about that a few weeks ago. Like, for example, the heart, once the heart is damaged, those cells, they don't come back. Very good. Very good. The abdominal tissue can repair itself. I'm so proud of you guys. I'm so proud of you guys today. Yes, it can repair itself, but it takes a long time. It takes a long time, right? So for kids, it can repair itself in about 6 months. That's still a long time. For adults, it could take up to 2 years. So this is why the gluten-free diet is a lifelong, very strict teaching point, because every time that the microvilli get damaged, they have to start the repair process. Okay. And so we have to let our patients know that even the little crumbs will cause damage. All right. That's it. That's it. It's in the book. You guys have to get in here. You have to get in here. You have to study it, and you have to be able to challenge yourself by critically thinking. When I come to class, I already expect you to have read this section of the book so I can just go off and ask you all kind of crazy questions. That's the fun part for me. Okay. We are going to be going over cerebrovascular accident on Monday in the same way. I want you guys right now to see how you feel. How do you feel now after studying celiac disease with me? Are you more confident? Do you feel like you can answer any types of questions? Or do you feel like, hey, I need to go back and study this a little bit more? Okay. For most of you, you have it. You have it to the degree that you can go on and do well. You don't need one-to-one tutoring. You don't need private tutoring. Okay, guys, you don't need it. You need structure. You need resources that match your learning style. Most of you on here, you're audio-visual learners, no matter what you think. Okay. You are also all adult learners. All right. That's it. It's Winning Wednesday, guys. I want to encourage you, number one, though, if you don't know your learning style, to quickly learn it. Okay. If you don't have the trial, if you do the trial of my course, you will be able to know very quickly what your learning style is. Okay. If you want to get into the trial, really simple. You guys can look at it. It's in my profile. All right. Another thing is remediation is the word of this week. Remediation means a focused redo. It does not mean just doing practice questions. It's literally doing what we just did. So I see TikTok has some questions. I'm going to go over to TikTok and do a question and answer. For those of you on Facebook and YouTube, if you want to join me, click over to there. Remember, I go live every Monday at 12 p.m. Eastern time. I'm on the East Coast. East Coast represent. Live on Mondays at noon. Okay. Live Wednesday nights, just like right now. Okay. 9 p.m. Eastern time is when I come on. Follow me, never lose me. Okay. That's what's going on. All right, everyone. So have a beautiful night. Also, I'm still doing the discount codes. You tell me your story. If you want the full course, I'll give you a discount code after we have that conversation. So I want to make sure that everybody is doing their part. And before you leave here, you know your next steps. So all minds, all hearts clear. I'll say good night to you guys. Winning Wednesday, you showed up. You did the work. I just made this space available for you to be consistent. And that's what you need. Content, critical thinking, consistency. All right, everyone. So I'll see you later, guys. Bye-bye.